Good morning, everyone. My name is Lisvel Matos. I am a doctoral fellow of this wonderful program, and it is my honor to introduce Dr. Reed Tuckson. He is here to give our keynote closing address, and his bio is extensive, so I do encourage you to look at that in the program. And I would also like to give a special acknowledgement to Dr. Tuckson's mother, who is here with us in the audience. So without further ado, I'll have Dr. Tuckson come up and join us.
Well, thank you very much. The reason my mother is here is because she is a nurse. And my earliest memories as a kid is of my mother getting up very early in the morning with that, and putting on that blue visiting nurse's uniform. Wearing a big black bag and setting off to the poorest parts of this city, Washington, D.C. And so that has a lot to do with my career aspirations. So here we go. We have a lot to cover today, but I just want to make sure, first of all, just say to you that congratulations on this fellowship. We are very, very impressed. This is a particularly important time for each of us in healthcare to rededicate ourselves to the values of professionalism, which of course at its core means a commitment to a lifetime of learning, to translate our expertise into service to and discourse with society. That is our responsibility, is to continue to advance our expertise, to translate it into service to and discourse with our societies. And I think that's why it's a beautifully wonderful privilege to be a health professional, is because while the rest of the folks our age, whatever age you are sitting around watching television, twiddling their thumbs and looking at TV going, oh my God, it's so terrible. What's going on out there? And they wring their hands. And so they're going to all wind up with arthritis. And then they get arthritis of the heart. We don't have that problem. Because no matter what, no matter how bad it is, we get the opportunity to say, well, I am doing something about this. And that's what's so important. So I give you that. This is an incredibly challenging time, unprecedented time to be in the health professions. Our industry is volatile, it is evolving, it is filled with challenges and opportunities, and it is characterized by relentless change across the continuum of care. Just to give you a snapshot of the magnitude of change in your profession, in what's happening around you. The fundamental scientific foundations of clinical medicine are evolving every day. Now that we are in the genomic era, all of healthcare is fundamentally being retranslated through the prism of genetics. I used to be the chairman of the Secretary of Health's Advisory Committee on Genetics, Health, and Society for many years out of NIH. When I started, the briefing books were fairly small. And now there are 43 telephone books in length. And by the way, could you imagine having a special commission on genetics today? You'd just be talking about a special commission on medicine. So you wouldn't even need to have it. The translation of new ideas and innovation into appropriate diagnostic and therapeutics. The reorganization of how healthcare is being delivered through ever larger integrated organizations and how it's being financed. Completely different. Advances in digital data, analytics, and clinical tools, the new movement towards patient centricity and consumerism in care. I'm going to come back to that in a moment, but this notion of consumerism in terms of the tools and benefit designs. And then there's the politics that define the infrastructure of how healthcare is delivered, the resources that will be available, that will define access, and will define in many ways the climate in which health and preventive medicine is delivered. All of these are fundamentally changing. This is a terrifically challenging time in the history of this nation. And quite frankly, it's a sad time, isn't it? With what we're seeing going on every day, the destruction of the civilizing values of the so-called American democracy. It's a challenging time for the health of people of color. It is a challenging time for all people. But as this pandemic has demonstrated, this is very much a time of distrust in medicine, a distrust in science, and a distrust in elites. Thank God the nursing profession is more than any other sector immune to some of that distrust, some of it, but not all. The context of your work will always now, in this moment, be defined very much by a concern around distrust. COVID has taught us the importance of a lot of things, but one of the things it has taught us, and I was asked to come because of a report that we wrote, and I'll tell you more about that in a minute, around COVID, but this has taught us the importance of grassroots community organizing. When I was the health commissioner in Washington, D.C., which I was privileged to be in this city during the height of the AIDS epidemic, the #1 rate-limiting step to try to overcome that problem was the question of distrust, and it was always the specter of Tuskegee. Always. Every time I got on a TV show or radio show and I would say, brothers, y'all got to wear a condom, it would come back with, well, you know, this thing was created by the CIA. This ain't a real problem. This is the white man's poison. This is the white man's deal. This ain't real. Oh, hey, y'all, way over here. They won't let you all join the rest? Okay. I didn't mean to ignore you. So I knew and learned indelibly that you can have government efforts from the top down, but without a bottom up, you're not getting anywhere. And so I'm sitting in my house on Easter Sunday, 2020. I live in Atlanta. Easter Sunday, 2020, and I looked at the data, early indications, and you could see what this train wreck was going to start to look like. I volunteered to say, well, I'll go be one of the doctors to try to, when all the regular doctors and the real people that are still practicing fall over, I'll, be in. Well, that didn't go over real well with my family. My wife had a seizure, and it was a stupid thing. I mean, I wouldn't have been very much help, but I'm 70-something years old. I couldn't have been that great, right, helping. So I said, well, you know what I'll do? I'll do what I know how to do. I'll do me. I know how to organize. I know how to pull people together. And so I picked up the phone Easter Sunday, and I cold called people that I knew in D.C., because we were all Zoomed, so I could do D.C. from Atlanta. And I called the ministers that I knew and trusted. Picked up the phone Sunday evening. Hey, we're going to have to get together. You in? In. Good. The organized labor leaders, in. Beauticians and barbershops, in. Poets, musicians, artists, in. People advocating for returning incarcerated citizens, in. Academics, Howard University, we're in. Doctors and nurses and so in other words, you take this broad spectrum of people, and we brought them together, no money, no administrative infrastructure, no permission. We just said, we're going to attack this problem, and we're going to address this issue in our community. And that's what we did, and we created a name called the Black Coalition Against COVID, and we started marching forward. Well, as we did that, we got ready, and we're putting PSAs out, you'll see some of a zillion stupid, crazy ideas. Just try them. Didn't ask for permission, no paralysis by analysis, just guerrilla warriors dropped into the war zone and just deal, right? And beg and borrow and plead and didn't worry about the money, no staff. But we saw that the most important thing that was about to hit us was going to be the need for a vaccine. And if you're going to have a vaccine, you got to have clinical trials. And here we go again, right back with Tuskegee, the white man, poison, and blah, 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 blah. So I reached out and I called the president of Howard University. I called the president of Morehouse School of Medicine. I called the president of Meharry Medical College. I called the president of Charles Drew University of Medicine and Science. One phone call, I'm in. Just like that. No worrying about, well, who's going to get credit? What about my brand? Let's worry about this. And who's going to get the most juice and the blah, blah, blah with the blah, blah, blah. We just did it. Then I picked the phone, called the National Medical Association president. Then I called the president of the National Black Nurses Association, Martha Dawson. And boom, all of them in. Then we called the National Urban League, and then we got the biggest publisher, online publisher of information, health information for the black community, blackdoctor.org. And all of a sudden, we had this national army that was instantly available to us. And so we created that, and that kind of got to be a lot of fun. So we just produced, as one of the many things we've done, and Janet was the person who asked me, I think, to come, because she was familiar with the publication, but not too many months ago, we put out a document called The State of Black America in COVID, a 2-year assessment. We looked back at this episode and wanted to get it done. We partnered to get it done with our colleagues at the Satcher Leadership Institute at Morehouse, but also Marcella Nunez-Smith, whose name you may have heard, or you should have. Marcella is this young black physician who was the chair of the Biden administration's Health Equity Task Force and became the person who, along with another black physician named Cameron Webb, the two leading White House people for COVID. She's now at Yale, and so we brought the Yale team together and we produced this 2-year assessment. Why did we write that report? Well, we felt compelled to tell our story contemporaneously. First, a couple of months ago, to make sure that people knew this ain't over. Everybody was starting to relax, and you're like, no. And the reason that we wanted to tell people this ain't over is because now this is gonna come as a big shock to y'all, you can't believe everything y'all read in the newspaper. I know, my goodness. When we looked during the week, this is when we started to write the report, January 8th of 2022, the hospitalization rate for black Americans was 64 per 100,000, the highest weekly rate of any time of any ethnicity group in the entire pandemic. This is when the news media was saying, this thing is almost over, it's dwindling down, this is not a problem anymore, and you can start to relax. And the White House called me and said, that statistic. And as soon as I heard that statistic and realized it, said, we have got to get out there again and keep pushing and pushing and pushing, because our community is not reflected in what people are beginning to see as a gestalt. Just think, this is only June, right, July. January 8th, more than double the highest weekly rate since seen the year before. So we really realize that data is extremely important. Why do we write the report? In addition to telling our community that this ain't over, is to document our suffering. And I wanted to make sure that people never forget what the data really is showing. And so for Black America, I mean, again, this is now at the early stages of this disease. And so in May, from March to May, we were seeing these kinds of differences in terms of impact. Unforgivable, unacceptable. And you simply cannot let that kind of thing go. This happened in America. And so the question is, what is the response? What did we do, and what will we do? We wrote the report in addition to documenting our suffering, but we wanted to use evidence to educate our community, our health policy leaders, about why and how we suffered, alerting for corrective action, and then ultimately we also wanted to make sure that we documented successes, because everything ain't a tale of woe and doom. Otherwise, how is the army going to march if you think you'll never, ever win the battle? So, why did we suffer so much? Pre-existing structural and social inequities have long driven these risk factors that led us to this place. This goes back a long way. The severity was a predictable result of structural and societal realities, not genetic predisposition. Not genetic predisposition. The pandemic took advantage of cross-sectoral inequalities that hampered health-promoting resilience. Workplace risk, housing, transportation, access to healthy food, ability to recreate, barriers to accessing health services, and the suboptimal quality of medical care were all determinant. Look at the combination of punches coming at us. It ain't like it was like one thing that we had to fight. Every one of them we had to fight simultaneously with no support. That's the key thing. And what pisses me off is when, you hear the, mean-spirited others who think that somehow magical thinking will make all of this go away. Well, we just don't talk about it, it'll just be fine, thank you very much. Nobody has ever had to fight, workplace. Who was doing the work? We want everybody to quarantine. Yeah, but what about the people driving the buses? What about the metro system person? What about the retail clerks in the supermarkets that are getting you the things you did? Those were our people. They couldn't Zoom it in. Housing. We want you to quarantine. That's what I was given the advice. You got to go to quarantine. Yeah, well, how many of our people live in multi-generational homes? One bathroom. How's that going to work? We looked out and saw all these young black kids on the playground during the quarantine time. And I got really upset with these children. How? In the house. We told them the rules. And then somebody said, Reed, you are making an assumption that home is a safe place for all these children. It ain't a safe place for many of these kids. How many women got beat up by frustrated men who was drinking and drugging because they were losing their work? You understand what I'm saying? This is deep stuff. Magical thinking don't solve these problems. Wishing it away doesn't. Access to healthy food, we already know. Can't go, let's go out jogging. You know. And this I'm going to come back to because this is really inexcusable, what our profession does to our people. We've known about these disparities for a long time. Those of you that are young, if you don't know about the Malone Heckler Task Force, make sure you put it in your Google. You cannot be a black health professional if you do not understand the Malone Heckler Task Force, which is the first time, 1985, that we ever documented the disparities in healthcare. Not 1960, 1945. It wasn't until 1985 that we documented or understood the disparities in healthcare. And we knew that 60,000 African Americans die every year prematurely if our health status was the same as for white America. What were the diseases? Cardiovascular disease, homicide, suicide, and accidents, cancer, infant mortality, substance abuse, and diabetes. Now, this is based on data that wasn't really terrific. I mean, it was the best that they could get at the time, so we can get even better at it. I know you're here to do substance abuse, and thank God for you, and learn all of that, and you know have a much better picture than I will of what these numbers look like today. But these are the issues. Very much they are issues of the choices we make and the chances we take. But very much they also are issues of whether you have the opportunity to make choices and whether you have to take chances. So this is a very subtle point. I'm not going to be able, because I got a lot to do and they throw you off if you're too long. So you want to be careful. But I'm going to try to always stay in the middle of the lane of being very clear about the structural issues, but also we cannot avoid personal responsibility and accountability for our behavior and our actions. You cannot avoid it. Now, when we say it because of the right-wing knuckleheads, they say it, so we can't say it. You know what I mean? Because the way they say it is a whole nother thing, right? You people, you know. So I don't want to be in the you people rule. But at the end of the day, we got to. But if we can talk in the family, come on, y'all. I mean, really? But it's hard, no question. Unfortunately, the life expectancy gaps, which have been so long, have now gotten worse. Each year since the pandemic, the disparities gap has widened. Each of the last 2 years. And now you can sort of see what that kind of looks like. I mean, just think about what that means. How many people fight for 3 months of extra life when they've got a life? How many of your patients have you seen that will take anything to get you to the kids being able to be able to watch your kid walk down the aisle? Y'all know what this means in human terms. See, that's the thing about y'all. You can put that up there. Most people don't know what that means. I mean, it's a statistic. It sounds bad. But when you put it in terms of people taking a toxic drug that makes your hair fall out just so you can watch somebody walk down the aisle, y'all understand the difference between 1.2 and 3. That's just not statistics. Those are human beings. Structural racism. It's important to talk about it. It's hard to talk about it, but it's real. And if Governor DeSantis in Florida has his way, you will never, ever know any of this. And somehow, magically, this thing will just go away as they keep doing what they've been doing since we've been here. Structural racism, a system in which public policies, institutional practice, cultural representation, and other norms work in various, often reinforcing ways to perpetrate racial group inequity. It identifies dimensions of our history and culture that have allowed privileges associated with whiteness and disadvantages associated with color to endure and adapt over time. It is not something that a few people or institutions choose to do. It's a train that just now runs automatic. It just runs, not like how to, it's like the system is so well designed, it's self-perpetuating. How did we get here? And this is something that most people just don't even think about how this happens and why it keeps happening. 400 years ago, our people were enslaved for 250 years. while 10 to 15 generations of white families grew wealth, accumulated capital, and passed it down through their families. 150 years ago, we got freed. Jim Crow kept us enslaved. Voter suppression was done. I remember as being a little kid first thinking about you couldn't vote, and then you had to pass. How many, you young people won't even know this. To be able to vote in many places, you had to be able to tell how many jelly beans were in that jar. Y'all didn't know that? Oh, yeah. You have to be able to tell how many jelly beans are in that jar. If you don't get the right number, you don't get to vote. That's how cold-blooded it was. While we were in Jim Crow, another group of generations of people continued to prosper and grow wealth and so forth. 125 years ago, we had erected honors and statues of people like J. Marion Sims for the father of OBGYN. The American father of OBGYN made his reputation on doing vaginal surgery on unanesthetized slaves. And that picture there is of a statue across from the New York Academy of Medicine in New York City honoring that man. And now what you're seeing is it is being torn down. Another 5 to 10 more generations of whites prospered. 90 years ago, the Tuskegee syphilis study, we'll come back to that. 60 years ago, legal to vote, freed from discrimination. And yet we all lived in segregated neighborhoods, segregated schools. Meanwhile, another 2 to 3 more generations of whites prospered. 50 years ago, 783 black students were enrolled in American medical schools, 2.2% of the overall total. Affirmative action came and goes, and now we've got the grand total of 5%. What is the percentage of, and I'm not saying this mean though, I'm not saying this to be against anybody, I'm saying what's possible. What is the percentage of women in medical school today? 50%. 50%. What is the percentage of black folks in medical school today? 5%. How did they do that? Change is possible. Change is possible. 40 years ago, when I was health commissioner in D.C., Tuskegee, AIDS was the issue. Tuskegee was our rate limiting step, conspiracy and distrust. And now, here we are with Black Lives Matter. Whatever you think about them, whatever you agree or not agree, the fact that you have hundreds of thousands of people taking to the city streets with a primal scream, my life matters. That is as much of a diagnostic signal of something being terribly wrong as any that I can think of. And so housing, food, jobs, criminal justice, voter disenfranchisement, all of this. By the way, you should get this book, which is excellent, but I will say that that's written by my brother-in-law, Eric Holder. He and I married sisters. So get his book. I don't get a commission, though. Today's challenge. Refusal by many in power to even acknowledge that structural barriers exist. This dude here is the Commissioner of Public Health for the great state of Virginia. He's been 5 months in the job. He rejects the idea that racism is a public health crisis, downplays it, and then he's doubting the well-established link between structural racism and health disparities. He's going to create a new investigative unit in his department to start fresh. Now, can you imagine? And the people that work in that Department of Public Health are going, what? This is the kind of thing that we have to contend with. Consequences, disproportional mental health impact. So we know that pandemic stresses such as job loss, economic insecurity, sharp increases then in anxiety, depression, and substance abuse. We, of course, are more likely to experience anxiety and depression. You all live this because substance abuse disorders, of course, increase so dramatically. And that's why you're retraining, augmenting your training to be able to deal with an increasing challenge. One study talked about opioid overdoses increased among black Americans as much as 52%. While I don't really think that is completely accurate. I question whether the white side went down that much. That doesn't make sense. But the point being, I'm just trying to indicate that people are thinking that, certainly we know it's higher. And I'll leave it at that. I'm not prepared to completely accept that first study. But stressors responsible for these behavioral changes are likely to continue their influence. And so what I'm getting at is, whatever it is now, it is going to get worse. And so we have to be prepared, and thank God that you're doing the work that you're doing. I particularly am fearful of our kids. I'm getting ready, we're now in the middle of doing a second report to this just on black children, because it's got to be talked about. These kids, as I mentioned, staying at home can be dangerous. 1 in 310 black children lost a parent or a caregiver. Can you imagine the number of kids that have lost their caregiver versus 1 in 730? I mean, it's just completely out of whack. And what this is, we're also seeing is significant impacts from the loss of in-school education. So our kids have fallen way behind in school, loss of socialization, but things like nutrition. This is where you get the food. And so we have those. See, all these issues come together. Magical thinking don't solve these kinds of problems. So, the elephant in the room, trust and distrust. So I wrote an editorial in Science magazine early in the pandemic, and I talked about the disease of distrust. And the reason I wrote it was because I thought about it. I said, now wait a minute. Tuskegee was my main problem 40 years ago. How could Tuskegee still be a problem today? And it hit me. The healthcare system, the research, clinical care delivery, policy, every single sector of the American healthcare enterprise has done nothing to take Tuskegee off the table in 40 years. How dare that be possible? How dare that be possible? And so I concluded it with the sense that we have got to find a way for everyone to start to work together. So this issue of mistrust and distrust is symbiotic with misinformation. It goes both ways. And so why do so many Americans distrust, science? And disinformation fuels distrust and even violence at all levels of government. So we're living in this environment now with increasing tribalization, increasing I'm in my group, and my group is different. And it's not just Democrats and Republicans, conservatives and liberals. I'm in the super group on social media. My tribe is this group, and your tribe is this group. And all we ever hear from is our tribe. We never hear the other tribes. We're now in our tribe. And in our tribe, we have to always protect our tribe. And we protect our tribe by denouncing anything that's not in my tribe. Information that is not in my tribe must be wrong, and I'll have to attack it. So you have this crazy social division, political polarization. Conspiracy theorists gravitate towards stories that confirm their suspicions. People get their information about the world from people and institutions that confirm their beliefs and discredit or ignore sources that run contrary to their beliefs. Disinformation fuels distrust, and it's just a virtuous cycle round and around and around. Misplaced trust and misinformation are pervasive and impactful. This Nicki Minaj lady, I don't know if y'all remember. My cousin, third removed, in Trinidad, had his testicles swell up because he took the vaccine and his wife wouldn't marry him now, and everybody died. This woman has 48, I put this in, so 48 million people heard that crap. And everybody from the Minister of Health for Trinidad and all of us had to stop what we were doing that day, fighting for black life, and deal with this idiot. All the work we've been doing, pushing the ball up. But this is where I'm saying, folks, one idiot has more power in black American society than Howard, Morehouse, NMA, Drew. You understand? That's what we're fighting. That's on us. That's on us. How could we let that happen? How does Nicki Minaj have more sway on health issues than the combined firepower of all the black academic and clinical leadership? We did something very wrong. We are too removed from our communities, aren't we? We're too removed from our communities. And we are not too removed from the 100 black women, 100 black men, Jack and Jill, Lynx. We're not too removed from them, but we're completely removed from Nicki Minaj. Those people is where we're removed. We're too highfalutin, aren't we? And by the way, I love all those organizations because I work with them, and they're terrific people, and they're well-minded. But come on, we got to get all the people. Misplaced trust and misinformation are pervasive and impactful. This nurse, viral TikTok, a 1.7 million TikTok viewers she had, 1.7. The best way to prevent STDs is waiting for sex until marriage. Just the truth. Black woman wrote back, if I go to get tested and the nurse tell me I should have waited till marriage, someone's getting knocked the F out. I guess that's what they talk about, real talk. Distrust of the American research, public health, and medical care system. Black Americans expected and experienced discrimination and bias. Now, this is the key thing. We expected it. We expected to be treated badly, and we experienced it. A 2020 national poll of Black Americans, most respondents anticipate experiencing discrimination and receiving disparate treatment when seeking care. 63% of respondents agreed that Black American patients with COVID-19 would be less likely to have everything done to save their lives. Yet we're trying to get people to come in to call your doctor, get to consult. If you're unsure, go to your physician or your your nurses and talk to you about it. Well, what actually happened? We faced enormous structural barriers to testing. We're going to have these test sites where you drive up. Well, I ain't got no car. And the testing is out way in where the football stadium is. We're not going out there. What is that? We don't know anything about that. And who those people testing me, drawing my blood? Are you kidding? Why wasn't it in my community? But see, they went to the old fallback. Who got the money to do the testing services out front? Who got the money to do it? It was the traditional big white companies. And so they would go where they're coming. So we're going to do a big thing out at Shabazz Ravine Stadium, Well, wait a minute. That's because they used to go into the basketball game, I guess. Early vaccination eligibility guidelines threatened equitable access for Black Americans. Early in the pandemic, we didn't have a lot of vaccine supply. So you had to figure out what are you going to do with the supply until you get a full amount. So I served on a commission from the National Academy of Medicine to talk about how do you kind of make this happen. Well, unfortunately, when it finally got to the feds, what they decided to do was that you were going to have internet-based services to be able to get on the list to get your vaccine. Really? Do y'all know anything about the Black community? And all of a sudden, people living on Martin Luther King Boulevard in city, you name it, see an influx of white women with fur coats on. First time they ever been in our community because they worked the game and got in line first and they got the doses. That's, of course, that's how that works. So again, the people in charge weren't thinking or could care less about how these things get implemented. Black Americans seeking care at emergency departments were less likely to be given a COVID-19 test when indicated, less likely to be admitted when diagnosed. Part of that was because we're too dumb to understand what pulse oximeters are and how they work, and the effect of skin color on the readings. And nobody was prepared for that. Nobody teaches these folks that. So they just assume that it's all just work. But has it been tested on people? Do you understand how it works? Do the numbers make sense? And we find out, of course, that there were mistakes. Black Americans were less likely to receive emerging therapies. So that when you first knew that there were things that you could do, especially with monoclonal antibodies and so forth and so on, we weren't getting access to those. First of all, we didn't know we were supposed to get access to it. And then when you do, you don't know where to go to get it. And when you do try it, there's no supply. But they seem to be in supply someplace. All right, so that's the end of the pissed off part. That's why the slide did. I was like, okay, I got tired at that point. The real issue is what we're going to do. How do we go forward? Because just being pissed doesn't do anything. So we remind ourselves of what it's all about. And we come back to the fundamentals, right? What is health? And you all know this. This is catechism. This is theologic. and we live with this every day, and we have to make sure we never forget. Health is a state of complete physical, mental, and social well-being, and not the absence of disease or infirmity. The enjoyment of, this is the World Health Organization, the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, or social condition, right? So very straightforward, very clear. So what is health equity? What we're trying to get. When all members of society enjoy a fair and just opportunity to be as healthy as possible. Equality is, you got the people trying, so they all got the same box. And this poor dude can't see nothing, right? But everybody got the box. So what you need is equity where people get what they need to be able to see the game, right? So, you know, he needed an extra box. This guy got, you know, he didn't need no box at all. So public health and medical care policies and programs need to center around the specifics of the individuals and the specifics of the communities. And that's really what this is really all about. So how do we get where we want to go? Number one, it starts with love. Starts with love. We got to get all that pissed off part of the show, now you can get rid of that. Because if we are not talking to our people with love, so we decided, and again, the Black coaching COVID, no money. And by the way, I used to be like a really, I'm going to tell you right now, I used to be a really important guy. Like, at one time, I was like the last job I had, I was the senior physician at the largest health company in America, UnitedHealth Group. Wow. I'm like Section 16 officer of the 20th largest company in America, right? Which meant I had assistants, I had an executive assistant, right? I ain't got nothing now. So the whole time I'm fighting COVID, I got like me. I am on the first name basis with every executive assistant to almost every human being in the world. I'm good at scheduling meetings. I'm good at scheduling appointments. I mean, I can do it. I mean, it's humbling, right? But I'm just saying to you, the reason why I'm making that point was not because I'm so great. I'm just saying, I don't want to hear nobody tell me they can't get nothing done because they don't got no money or no staff or no nothing. All I know is I didn't eat dinner a whole lot of nights, and my wife almost divorced me. She was really pissed off because, you know, it's like, come sit. Baby, I'm sorry. I'm dialing. I'm on the phone. And my point only is that I just don't want to hear anybody give me excuses about why we cannot fight for black life. That's all I'm saying. So we must begin with love. So we call, again, cold calls. Cold calls. Called up an advertising company that we liked and we loved them. They were wonderful people. We said, look, we got to deal with this. This is what happened. Okay, let me try one more time. Is it me? All right, so I push that.
Dear Black America, we love you. We affirm that Black lives matter. And as Black health professionals, we have a higher calling to stand for racial justice and to fight for health equity. In the spirit of unconditional love for every single Black American, we have locked arms in an initiative to place the health and safety of our community at the heart of the national conversation about COVID-19. Respect for our Black bodies and our Black lives must be a core value for those who are working to find the vaccine for this virus that has already taken so many of our loved ones. Our colleagues across healthcare know that we are urging our community to take safe and effective vaccines once available. However, for this to be successful, they must do more to earn your trust now and in the future. We are on the front lines in care delivery and in key decision-making roles, from the lab to the clinic to the virtual boardroom. We urge you to hold us accountable. Please wear your masks, continue social distancing, hand washing, and avoiding indoor events until vaccines are widely available. With the holidays around the corner, we want nothing more than to break bread with our loved ones. but tradition cannot stand in the way of our health. We also ask you to join us in participating in clinical trials and taking a vaccine once it's proven safe and effective. We know that our collective role in helping to create a vaccine that works for Black people and that we trust has an impact on our very survival. Please visit blackcoalitionagainstcovid.org/love letter to learn more about the work we are doing to keep our beloved community safe. We will keep you in our hearts while we work to create a world that is healthier and more just than the one we know today. Love, America's Black doctors and nurses.
So, you see what I mean? It starts with love. Number two, we have to discover a shared vision of respect for human life, devoid of the poisons of hate, racism, white supremacy, inferiority, rage, despair, victim, you name the issue. Not just a Black or minority conversation. We all have to test, examine, and explore our assumptions about what happens when nothing is true anymore, when there's no source of truth, when what happens when all the myths of American exceptionalism are gone, the myth of an inclusive and functioning democracy, the myth of the Statue of Liberty. You know, Trump sure put an end to that one. The myth of the value of a free and independent press, the myth that the key institutions of society can be trusted. How do we start to go forward? And we've got to do that with a sense of shared respect for life. Now, there are politicians in America that were ready and willing and able to say during the height of the pandemic, all right, folks, them old folks just got to die. They just got to die. Because you can't stand in the way of business. Commerce is the deal here. And, you know, they should be prepared to sacrifice their, I'm sorry, moms, you're selfish, you know, hanging on like this. You get in the way of the economy. So we've got to get back to a place where there is respect. And that's what you as nursing can do and all of us have to do over and over again. No matter what color, who they are, we've got to inject in America a respect for life. Otherwise, we're in deep trouble. Number three, we have to create a data-driven shared vision for health. In other words, we got to bring people together in our communities to talk about what are the health issues. When I was, one of my jobs that I had, which was a wonderful job, I was the president of the Charles R. Drew University of Medicine and Science in South Central Los Angeles, Watts, okay? And I was full of fire and vigor, vim and vigor. We're going to have the health fair because we want to get out there. I got all the data. I know what's killing y'all in Watts, and we're going to just go out to, we got a clown and a boombox and a van, and balloons, and we went out to the community to have the health fair, and nobody showed up. And we knew immediately what the problem was. We needed to have more four-color brochures. So we got more brochures printed, fired the clown, got a better clown, got more, got bigger balloons, and we went back out again, and 5 people showed up. And then we went, okay. What's wrong with those people over there? They don't want the resources that we're bringing them. They're suboptimal. They don't deserve all of it. You know, that's what you do when you get emotional. And then you realize that maybe what we need to do is to hire the community itself to plan the health fair, and they invite us in. Well, they wanted to do disease number 3. We know that our data is disease number 1. Who cares? Once you build a highway, you can drive any car you want over the highway. So we would do whatever they wanted to do. We got to have conversations that bring everybody in the room together. Chamber of Commerce, employers, Black community, all of us together, and have the conversation about what is happening to us, what's killing us, and then what can we do? How do we organize and mobilize all of the assets? Every community, regardless of its challenges, has its strengths. We have to stop looking at Black communities from the concept of their deficits and look at them through the prism of their strengths and build on those. And every community has its strengths. And so we have to start to organize these resources and then try to also work to achieve fairness and equity and so forth for optimal health. So I'm really, really, really urging people to spend time working your communities wherever you are and being part of the catalyst that brings people together to have this conversation that prioritizes our challenges and organizes our assets forward. Number 4, We've got to come to an understanding of what is required by individuals to be fully realized selves. This is what I was getting at with this personal accountability thing again. How do we help ourselves to get to that place? How do we create and reinforce individuals to have the autonomy, the ability to make life-affirming choices, choices that are aligned with our optimal mental and physical and spiritual health? The autonomy of the individual that also has the means by which to express their intent. So it's both together. The need to participate in the governance of the forces that determine and control and orchestrate the context of our lives. Governance. We need to be participating in the sharing of power. Otherwise, we don't make decisions. We're told what to do. We're not part of the decision-making process. And so we need every one of you in your spare time to accept assignment with the Greater Dallas Health Council or the Greater Milwaukee blah, 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 blah. Be in those places. They might not seem exciting to you at the time, but you make them exciting. You make it worthwhile by your being there. But we've got to find ways of being in that governance process. Ultimately, it boils down to people being able to make choices. The choice of purpose and vision for the society as a whole, the choice or the ability to choose as an individual, the choice to approach things from the perspective of victim or empowered person. I will never, ever be victim. Ever. You cannot, white America cannot make me anybody's victim. I ain't going for it. I never will allow myself to be that impotent. Can't happen. The choice to struggle alone or with others, the choice to reinforce tribe, and this is the hard part, or reach across the divide that separates us from others. I'm not always a good enough of a man to do this. I'll be honest. There's some people that just piss me off too bad. I'm in trouble with using words like pissed off. My mother's here. Oh, Jesus. It's going to be, I'm not going to get that Christmas present. But how do we reach across? So you're in the hospital with racist number 42. Do you just leave it there? Is that the end of it? Do you walk up to Mr. Racist number 42 and say, racist 42? Does that change anything? Do the black people that are depending on a hospital decision-making to have resources from the hospital to go into the community, do you win anything for the people you are fighting for by punching racist number 42 in the mouth? No. You got to up your game. You got to up your game, and you may not win, but at least you try. And it wasn't about you. It was about them. So how much of a behind whipping are you prepared to take for them? It ain't about you. The consequences of choosing not to engage and to resort to fantasy myths of what, like the Virginia Health Commissioner. Accountability for our own action to ourselves, our families, and our community. How do we get to where we want to go? Overcoming distrust and engendering respect for science. So the Tuskegee thing. 40 years in my life spent with Tuskegee. And I finally said, you know what? So I read an article somewhere in the newspaper about the family members of the descendants from Tuskegee. And it said that they were vaccinated. It was a little teeny thing. No, it wasn't an article. I was interviewed by a reporter who, for something else. And in the context, he said, I just got back from talking to some of these families from Tuskegee, and they're immunized. I said, stop. And when you do some of these interviews, you got like media consultants listening to make sure you don't screw up, and they want, and like, because this story, whatever they were interviewing about was important to somebody or another, so they had their media person listening in to make sure I didn't screw it up. And I said to her, man, stop, whatever. What did you just say? You said the Tuskegee family members are immunized. Well, give me a name. And he gave me a name and a phone number. I said, by the way, that is the story. Whatever this thing is you talking to me about, it's important. I'll finish it with you, and I don't want to piss off the media consultant, but this ain't nothing compared to this, what you just said to me. So we picked up the phone and we cold called them. And we said, we want to meet you, we want to know who you are, and this is what resulted.
I am the daughter of one of the men in the study, Freddie Lee Tyson. I'm also the daughter of Johnny May Neal Tyson. I have to include my wonderful mother because the two of them was on the journey together. My father had congenital syphilis from his mother. When penicillin became available, the men were denied treatment. There has been a lot of references to the study as to why some people may or may not want to take the vaccine. A lot of misinformation is out there. We have the ability to find out the facts and the opportunity to talk with people who could help us go through the facts, and don't deny ourselves the opportunity the men were denied.
We have about 5 of those. We have 5 of those that are that same thing. So you can go, it's up to you, COVID-19 vaccination. You can go to our website. There's a lot of places where you can pull up these. But what their basic point was, and some of the other ones, I don't have time to do it today to go through them all, but what they're basically saying is that they are pissed off that people would misuse their legacy of the suffering of their relatives, her father. Other ones talked about their grandparents. By the way, about 6 or 7 of the people we met are in the health fields. But what they said is this: Black community, y'all got to understand. You don't even know what Tuskegee really was about. What Tuskegee was about was people with a disease were denied the drug that would have cured them for the sake of a study to see what would happen. How can you use that upsetness to deny yourself the vaccine that would prevent you from becoming ill? It's completely stupid. It's completely backward. You're going to say that you're supporting the travesty of Tuskegee by killing yourself. What? Are you insane? But that's what they wanted to get out. So we've been pushing that. By the way, they're the nicest people you ever want to meet. Just the nicest, wonderfulest people. Okay. So I am trying to deal with this issue of trust and distrust. Right before the pandemic, and nobody noticed it, America's senior corporate leaders, Jamie Dimon from Morgan Stanley, Bezos, Apple, brother in charge of Merck, on and on. They all came together and said, maybe shareholder value is not the number one thing we should be judged by. Maybe it is our corporate responsibility to the communities in which we live and work. Doggone it, the COVID thing didn't come and wash that out. So I'm now leading an effort to have every sector of healthcare, and I've got with me the American Association for the Advancement of Science, the American Board of Internal Medicine, Bio, the trade association for all those groups, Pharma, the trade association for all those people, the National Academy of Medicine, the Smithsonian Institute, and on and on and on. I got all these weird, Milbank Foundation, Hastings Center Foundation, Commonwealth Foundation, National Medical Association. All these people are into the thing. And what we're early days, but what we're going to try to do is to have the entire sector of healthcare make a manifesto, somewhat like this, that basically says, we commit to respecting the dignity and the worth of every human being that interacts with any sector of the healthcare system, and we will speak truth and science evidence always to our people. I just want to start there, and then we'll go forward. It's never been done before in the history of our profession, and I'm determined to get it done. So stay tuned and say a few prayers our way. But the energy, all those people are in. Now it's just, they're in, they're coming. It's like a snowball. We're building it. And I'm going to keep at it. That comes out of that science editorial that I started before. Number 6. Grassroots engagement and partnering health professionals and faith and community leaders are important. I just have here one of our key partners is Choose Healthy Life, this incredible Black clergy effort, co-chaired by Al Sharpton and Reverend Calvin Butts. Al Sharpton, political minister, Calvin Butts, like doctorate of theology, super mild-mannered kind of guy, 2 completely different expressions of theologic representation in the world. And they got 30 states now where they've got, what they do, and it's the most amazing thing. It was the first thing we did in D.C. was to partner with the churches in D.C. on this. They have health navigators as part of from the congregation. So the minister deputizes Sister Mary as the navigator for our congregation. Sister Mary gets trained, and during the pandemic, especially during the quarantine, checking in with every single person who's got domestic violence, who doesn't have enough food, who's got housing, and just doing it, and then coordinating and sending them then to social workers. And in DC, what we did, we got Howard University School of Social Work to come in and then try to solve the problems that the navigators were identifying. This is like, this can be, you can do this. So by the way, I don't have a patent on it. Nobody does. So you can do this. You can make this kind of thing happen. So partnering across the board. So we did, as part of our national effort, we've done 25 national town halls reaching well over 4 million people. These Zoom calls. I mean, it's been weird, been fun. So here is an example of a flyer here where we engaged with our brothers and sisters from the Hispanic, Native American, well, American Indian, and Asian Pacific Islander medical societies, and the advocates from those communities. And we put everybody together in a town hall. And these are all the logos from all those community-based advocacy groups and the professional societies together to basically talk about how we are in this together and fighting like crazy. We brought health professionals engaging with our Black social, faith, and political organizations. So those of you who know the Divine Nine, pick your logo. I don't want to. I know somebody's going to go woo whoop or something, but you in one of those? No. Okay, all right. You in one, so everybody, but this is some good stuff. So who did we bring and deliver to them? We delivered to them Fauci, all the presidents of the medical, Dr. Corbett. We delivered them Peter Marks from the FDA. This dude, he is the guy in charge of all of the vaccine approval decisions in the United States. He's the guy, not the head of the FDA. He's in charge of the biologics evaluation thing. He's the one that has to ultimately say this vaccine is safe and for these purposes and so on and so on. This dude has been on every show I've done, almost, except for something that had nothing to do with vaccine. He has been on every show I've done. One phone call to Peter Marks, when and where. It's amazing. He's a beautiful, beautiful dude. Really like him a lot. But we have all these community leaders, the Surgeon General. I mean, we in other words, we can deliver this to our social organizations, and then they can build the audience and get the messages out to them. I'm excited so much. I've got a great partnership going now with 100 Black women, where they're getting ready to do 3 webinars and 2 town halls. And they call, and we're like, I said, just what do you want? I'll stock it. I'll organize every expert across the board that you need. You build the audience, I will bring you the product. Free. No money. Not a dime. Black health professionals have got to step up to the plate. And can you imagine me picking up a phone to a Black doctor or a Black nurse and say, we got this thing with 100 Black women, we're getting ready to do it. Well, what's my honorarium? No, not this one. These are all free. And when we make money doing things, the money we make, it goes right back into the organization. Right back into the organization so that we can buy PSA time, ad time, and so forth and so on. One of the most fun things we did was partnering with the community. So in DC, the dominant music form is go-go, which, by the way, is much better than anybody else's music. The heck with Brooklyn. So Anwan Big G Glover is the guy in DC. Picked up the phone, Anwan, need you to do a photo shoot wearing your mask. Would you be willing to do it? Now, most of our entertainers, everybody loves Ali, right? Everybody loves Ali. Ali, he's the greatest in the world. All these entertainers, the athletes, oh, we love Ali. Ali walked away from gazillions of dollars because of what he believed in his heart. Try to get one of these doggone athletes or entertainers to support vaccines. Oh no, you're messing with my base. My base, them brothers and sisters in the hood, no, they won't like me. They won't buy my, I can't make no, I ain't saying nothing. It was look back and see how many Black leaders, entertainers, they actually came out in support. They either sat on their hands or they did a Kyrie Irving. They love Ali, but don't mess with the brand because you're messing with the money. They Every time they took the money over what needed to be done. So Anwan, he said, yeah, happy to do it. So then we picked up the phone, cold call, called the metro system, the bus and transit system in DC. Hey, do you know the people with COVID are getting on your buses and they're killing your ticket taker. Oh yeah, that's right. I said, so I tell you what, I'm gonna take some money out of my pocket and I'm gonna send this dude to a photographer, actually your friend, Gary Cameron. I'm gonna send him to a photographer and we're gonna take his picture and we're gonna hand it to you at the bus system and you all are gonna make the posters and put them all over the metro system. And that's exactly what happened. No money, it just happened. And Anwan says, I wear my mask and you should too, this ain't, that was our tagline. By the way, that was at the beginning. This ain't over, we're still using it. Then we decided, hey, how about if you can make videos on your cell phone very easily. I didn't know this because I'm old. But they told me. So we said, we will, again, you go in your pocket. We said, we're going up, no grant. We didn't have time to write a grant, right? And the grant was taken by the big white companies anyway. They already had their money and they wasn't giving it to us, or unless we go through like 43 loops. So we just said, to hell with it. You make a video, citywide contest, 30 seconds on your cell phone, and the winners will give you $1,000 for the winner and $500 and $250. And we just did it. The person that won it, I don't have time to show it, the person that won it was a 9th grader. And it was the baddest thing you've ever seen in your life. It was so good that the mayor had her come up at a press conference and say, hey, you all got to hear this, right? We did poetry slams. Translate the jargon into language that people can understand. So we did a poetry slam. Had elementary school, junior and senior high, and adults. And they did poetry slam. And we got the same award stuff out and put it everywhere. And we had all of a sudden all the public health gobbledygook got translated into the stuff that they know how to do. And it was just terrific. In fact, yeah, that was it. So, and this is like this little kid, won, and we broadcast it all over the thing. We did a TV show on kids and depression and COVID early in the game during the quarantine. And we had the kids go on there and talk, and we had psychiatrists and psychologists to be able to, how do parents cope? We turned it into a TV show that was broadcast here, again, locally. So you can do stuff. Here's the point. And I told you I wanted to document our successes. Look where we were in May 2021. Eligible black Americans, eligible white Americans, 2 doses, 44 versus 56. Look at where we are now. This is the first example that I know of, the best example I know of, where we closed or eliminated a disparity because we all worked together. And this was a black community did that. So we had a meeting last Monday with the Secretary of Health. And we walked into his office and we said to the Secretary of Health, look, dude, you need to know that we took care of our stuff. Y'all gave us a little bit of money. It's already run out. I'm not talking about black, I'm talking the black community, not black coalition. Y'all gave us a little bit of dollars on the edge. We had to beg and borrow for that. But look at what we did. So we made these funding recommendations in our report. Federal and local governments need to establish funding mechanisms that will facilitate the sustainable community infrastructure complex. Black fraternal social philanthropy need to be funded to continue. In other words, we're saying this money needs to free up right now because we are not welfare. And this is not just pissing away money down a black hole. We have shown you. So the CDC just came out with an announcement for $4 billion of community-based public health money. $4 billion. Now, we got to make sure we get our share of that. And we told the Secretary of Health, we are watching. And by the way, we are sick and tired of being taken for granted. And the midterms are coming up. Y'all want these preachers to say something nice? Don't think you can just say, you can pat us on the head and say, aren't y'all so sweet and lovely? And take us for granted. We're going to play some hardball from now on. Because I'm telling you, these Democrats, they take us for granted like you cannot believe. And the Republicans just don't give a damn one way or the other. I got to hurry up because I want to be able to take a few questions. I have just 3 more after this, and these are fast. Where do we go? Take full advantage of the redesign of the conceptual and reimbursement basis of the delivery system. Healthcare is changing very, very rapidly. We have to be a part of the cutting edge. This is the triple aim. I know you know this. This is theologic, but we've got to enhance the patient experience with care, quality, 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 access, reliability, improve the health of the population, and reduce the per capita cost of care. That's the mantra going forward. So, unequal treatment in 2002 told us, documented the disparities in quality of care delivery to people of color. If you don't know this report, especially for the younger people, you Google this. But more important even than that, you must Google Crossing the Quality Chasm. That report in 2001, which says there is a chasm in the quality of care. But what year is this? 22. What year was that? 01. Look at the recommendations that were made in 01. This is just, what is wrong with our industry? Why are we so slow? We are more than prepared to accept the status quo. This is where I do want y'all to be a little bit ugly. You got to be a little mean inside these organizations to get to this change. Because we've known what we're supposed to do since 2001. Evidence-based decisions. Cooperation among clinicians. Now, by the way, the context I'm saying this in is black folks with multiple chronic illnesses, right? Requiring care from several different providers, several different settings of care, right? That's our life. Evidence-based decision, cooperation among clinicians, anticipation of the patient's needs. Patient as the source of control. 2001. Care based on continuous healing relationships. Customization based on patients' needs and values. And then underlying all of it, shared knowledge and the free flow of information across settings of care. What's happening with the redesign of the delivery system, and don't worry about this looking a little complicated, it's not that bad, is that what we are doing now is we're saying to the delivery system, we're not going to pay you for fee-for-service anymore, just because you make a sleeve and then come back and get another sleeve and then put the back to the vest, and before you know it, you may have like a weird-looking, a suit, right? We're going to pay you for the suit, and y'all figure out how to use your money to get paid for all the other stuff. So we're going to worry about outcomes. What does that say? If you're going to make your money, you don't get to make your money by keep on treating the same, the thing over and over and over and over again. You're going to make your money because you're going to have to find where that person, before they get sick, before they tip, and keep them from getting sick so they don't have to go to the hospital and spend the money, and then that's where your profit comes. It's a whole nother way of viewing it. So instead of the healthcare system being focused from here on over, we now have to start coming upstream and worry about behavioral factors, resilience and spirituality, in addition to the genetics and physiology, and then social determinants and the physical environment. All of that starts to play into the interest of the delivery system and partnering what's happening upstream, not just what's happening downstream. And so what you get then, number 8, is to do any of that, you got to have data. You got to know who's at high risk, who's early. Be able to then make sure you try to not have to go down here, deal with it here by going up here, and now you don't spend the money. But it's data, 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 data. You have to be attentive to data. So data has to be a tool to combat structural racism. There are about 30 states that won't even report data by race on COVID. It's very hard to get data out of these people because they don't want to know. Nearly a quarter of confirmed cases nationally are missing race and ethnicity data. We have to advance the ethical use of data. We got to make sure that researchers can adapt alternative estimation methods even when you can't get all the data. So you got to use some science to be able to try to get you done. But the challenges that we really have to face now are going to be with the algorithms. You're going to see so much of healthcare built, the decision-making process is going to be built in through algorithms. do those algorithms make sense for us? And is there bias in the information that's going into the algorithms? And the answer is absolutely yes. And so all approaches to data analysis should apply in equity. So if you're in the meeting, team meeting at your facility, and they're going, well, we got the new decision support tool that's using the advanced algorithms, and they're going to be sounding so exciting. And we're partnering with Microsoft or Google and blah, 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 blah. And, excuse me, the algorithms that are underneath that, have they been tested and studied on people of color and different populations and so forth and so on? And do we know that, have they been certified by any outside people as to being realistic and good? That's an inappropriate question, because of course they are, and you're not qualified to question. Really? Is the algorithm information inside of these decision support tools public, or is it a secret? Is it a black box, or is it open to review? Who has reviewed these things? Has the National Medical Association had a chance to opine on this? You see my point? You're in the room. Number 9, I'm almost done. How do we get where we want to go? Using information education to advance consumer behavior change. We are in the era of healthcare consumerism. Have you noticed the companies that are in healthcare today? Google, Microsoft, all these people, because they see this industry is ripe to be taken over. If y'all can't figure out how to employ or do crossing the quality chasm in 20 years, that tells me y'all are a little slow off the mark. Amazon ain't playing. See, they move in the speed of light. So we know from our data who needs to be reached. We know what they need to be reached by. Mrs. Jones has not had her mammogram, even though she is in the eligible population for it. And our data tells us she's, even after having been told she needed to get it, she didn't get it. So we know we need to reach Mrs. Jones. We know what we need to talk to her about. The question is, how do we talk to Mrs. Jones? And that's a whole nother deal. Beware that the competencies needed in a consumer-oriented world are going to worsen disparities. And so now you've got a 10, I'm saying you've got to solve for the engagement with the patient in a complex world. All these new tools, remote monitoring, you know how much hospital care is going to be delivered in the home now, hospital in the home. You know all the monitoring things. Y'all got to take care of yourselves now. So here's the algorithm, the monitor, and how many people are ready for that? Who's going to train and teach that? So who knows the health beliefs? How likely is it that you will have a health event? Self-efficacy. Are you confident that you can actually do something about this? Local control. How likely is it that your behaviors will actually affect that? We think we know, but does the patient we're talking to know the same thing you know? Do they know how to use the tool? Self-confidence and so forth and so on. Whole new education issue. Y'all remember Angelique Jolie? She had this beautiful model-like woman who had breast cancer and had a genetic predisposition to other cancers. She didn't get a diagnosis that says, you have this or you don't have that. You have a probabilistical, statistical likelihood that. Now, wait a minute. How many people you know had a course in statistics? In the community. Angelique Jolie can pick up the phone and call anybody in the universe and they'll break it down for her. How many certified genetic counselors are in the United States today? 5,500. That's including Canada. That was at least as of before the pandemic. Now maybe they got a whole bunch in. Okay, so there's 10,000. Problem solved. The number of facts per decision in a genomic environment increases with our increasing understanding of genetics. The one thing that didn't change at all, we just as dumb as we were today as we were yesterday. So how are we going to be able to have people participate in the modern world? We have to focus on teaching. So I pick up the phone and you call. I just love picking up the phone. Call the person that's in charge of the Association of Secondary Science Teachers. Hello? Who are you? Me? Nobody ever calls us. You're the only person who's ever called us. I said, what do you need, sir? He said, we can't get past teaching evolution. Not sure what I can do to help you, Dr. Tuckson. We can't get past evolution in the school system. So now I'm trying to call for everybody adopting the Science and Math Secondary Teachers Association. All right, so we got to go. I can't do, just look at these really fast, but you'll like the last one. These are all recommendations in the report. And the last one you'll like. The immediate expansion of the, come back. The immediate expansion, because this is where I'm pandering to the audience. The immediate expansion of the black nursing work. Anyway, the immediate expansion of the black nursing force, and we need to be able to train our secondary and high schools to be able to produce people like you. So, I am done, but I'm going to just say this to you, and that's ending where I am. I'm ending where I started, and this is, and I know I really screwed up for the questions, and Janet is never going to forgive me. I do believe in personal accountability. And this whole thing was about all those other things. But the only thing I know to do is what I can do. So you mean to tell me that someone down your ancestry line survived being chained to other human bodies for several months in the bottom of a disease-infested ship during the Middle Passage, lost their language, customs, and traditions, picked up the English language as best they could while working free of charge from sunup to sundown as they watched their babies sold out of their arms and women raped by ruthless slave owners, took names with no last names, no birth certificates, no heritage of any kind, braved the Underground Railroad, survived the Civil War to enter into sharecropping, learned to read and write out of sheer will and determination, faced the burning crosses of the KKK, averted their eyes at the black bodies swinging from ropes hanging on trees, fought in world wars as soldiers to return to America as boys, hosed in Birmingham, beaten in Selma, jailed in Wilmington, assassinated in Memphis, segregated throughout the South, ghettoed throughout the North, ignored in history books, stereotyped in Hollywood, and in spite of it all, someone in your family line endured every era to make sure that you would get here. Now, if you receive one rejection, face one obstacle, lose one friend, get overlooked, you want to quit? How dare you entertain the very thought of quitting? People you will never know survive from generation to generation so you could succeed. Don't you dare let them down. It's not in our DNA to quit.
Congratulations, you raised a wonderful son. And also, Mother, I know that they explained to you. The apple does not fall far from the tree.
I'll be really fast.
First of all, I want to thank you on behalf of all of us here. This was so inspiring, and this is what we needed to end and go out and do the work that we all need to do. And so I graduated from Coppin State in Baltimore as an undergrad, and part of our community health program, we had to go out in the community and meet people in the community, learn who has the kids that have lead poisoning, and do all of that, and go jump up the steps that had no stairs, and and sometimes meet the boyfriend that only showed up on payday on the first of the month. But so it was a little scary, but I think those are the things we need to do. We need to go out and find out who's in our community and how we can make the change to get back to the basics.
I love it.
So.
Thank you. I appreciate it. And the reason why I really appreciate that is, again, not to, but the lessons that I learned, see, this all comes from my mom. So everything I've done here comes from, see, what my mom did was to go down the alleyways in D.C. with that black bag and her nurse's uniform and the dudes playing craps. See, we learned this as children. The people that are playing craps would say, shh, y'all be cool, the nurse is here. Back in them days, it was the nurses, and then they would say, listen, you need to go over there to this one here because it's this pregnant lady and she's smoking cigarettes and getting sick. Yeah. 10 years after we learned that from her, she stopped wearing her uniform and she didn't carry her black bag anymore. And we said, Mom, what's going on? Because they would kill her. Because the criminals had gotten so strong, they would take the drugs from her. So she couldn't go down the alley anymore. Things have changed. So real talk, sister, real talk. Another one quick. Anybody else have a question?
We're all going to go back to our own communities. Do you have a formula for forming an effective coalition, grassroots movement?
I think the way, at least the only thing I can tell you, the way that we did it is it's personal relationships with other people and think broadly. So it's basically find the coalition of the willing. You do it by just saying, we have this problem. I'm trying to figure it out. What are your thoughts? Elizabeth, I'm glad you asked me. The most important organizing tool for a coalition is listening. Listening to other people about their ideas. You don't have to tell them you have the answers. It's like you're saying we have to do. The only thing I'm saying is we have something we have to do. How do we do this? What can you contribute? What can you contribute? Who do you know? My steering committee on it has people who are not doctors, not nurses. Some are. Some are just, a lady that used to be a newscaster here in D.C. 20 years ago. She doesn't have any of this. But what she does know is how then can I try to get a PSA on the air? The person that's running now, she's evolved to running our organization for us, is a hip hop artist. But hip hop artists, I come find out, if you want to try to make a career, you got to know the internet. You got to know social media. So she's really good at messaging and getting stuff. And by the way, she knows the poets. And she knows it. So she brought those people in. My point is listening and then engaging people around moral purposes and then just figure it out. Start somewhere. Don't worry about, is it perfect? Is it the enemy of the good is the perfect. Don't worry about the end. Just go. Do one thing. You do one thing, something else happens, and something else happens. I think 10 seconds for the one last one.
Well, whoever would like, he's got 10 seconds for one more question.
Anybody else? If not, listen, you guys are terrific. And Janet Jackson, thank you for the opportunity. She's got a copy of the report. She can tell you how to get it. We're going to keep working on the next one. Stay tuned, but just do something. All right, thank you. Good luck.
Thank you, Dr. Tuckson. We appreciate you.